Let's see an NCLEX RN video on oxygen therapy management. First question, the nurse includes which nursing diagnosis in the plan of care for the patient admitted with pneumonia? So the condition is pneumonia. You have to find the nursing diagnosis which is related to pneumonia. Anxiety related to hypoxia, deficient knowledge related to cause of disorder, fear related to the threat of pain, ineffective breathing pattern related to decreased surfactant. When you are thinking about pneumonia, you know that the symptoms of pneumonia include dyspnea, tachypnea, hypoxia. If you see at the first option, anxiety related to hypoxia, you know that when a patient don't receive enough oxygen, they experience signs of hypoxia, and the signs of hypoxia include change in mental status, anxiety, restlessness, confusion, because the brain cells are not receiving adequate supply of oxygen. So the first option is correct, anxiety related to hypoxia. Then you just think about the other options also. Whether there is a deficient knowledge related to the cause of the disorder. Actually, when we are formulating nursing diagnosis, you need to think what are the problems the patient is facing. Actually, they will be having knowledge deficit mostly related to the management. They may not be worried about the cause. So second option is not that much correct. The third one, fear related to the threat of pain. When a patient is having pneumonia, they don't have any idea about any invasive procedures being carried out on them. So that fear is also not relevant in our condition. The fourth one, ineffective breathing pattern related to decreased surfactant. This is an option where confusion will come for you. But here you need to think like pneumonia causes respiratory distress due to inflammation and fluid accumulation in the lungs. It doesn't typically cause a decrease in surfactant. That is not that much evident. Ineffective breathing pattern also in that option, that does not directly relate to the decreased surfactant in case of pneumonia. In pneumonia, if we are talking about ineffective breathing pattern, you need to tell it is related to airway obstruction or lung consolidation, or it is related to inflammation, or it is related to anxiety. Like that you need to tell. So this option, ineffective breathing pattern related to decreased surfactant, is also wrong. Second question, the nurse is reviewing orders on the patient who is to receive supplemental oxygen. It is a priority for the nurse to follow up with the provider about which order. So the patient is about to receive oxygen. At that time, the nurse is looking at the order of the physician and she has a doubt in one order. So you have to choose that one. Nasal cannula at 2 liters per minute is one order. Second one, Venturi mask at 24% concentration. Nasal cannula at 8 liters per minute. Venturi mask at 50% concentration. So here this answer you can only give when you know how much liters of oxygen each device will provide, or how much percentage of oxygen each device will be providing. So let's see the answer. The answer is nasal cannula at 8 liters per minute. You need to know about this non-invasive and invasive oxygen delivery methods for this. If you see the non-invasive oxygen delivery devices, there are something like the low flow delivery devices, which are the nasal cannula, face mask, and this face mask includes simple face mask, partial rebreather mask, and non-rebreather mask. So they are low flow delivery devices, and there are high flow delivery devices like the Venturi mask, aerosol mask, then tracheostomy. Okay, so let's see one slide. This is based on the devices and the oxygen concentration they will be providing. So if you are seeing the nasal cannula, the simple nasal cannula, it will be providing an oxygen concentration of 24% to 44%. 1 liter per minute to 6 liter per minute is the rate in which we need to supply oxygen through nasal cannula. In our previous question, you saw that the nasal cannula order was written 8 liter per minute. It should not happen. You need to know that through nasal cannula, it should be 1 liter to 6 liter per minute, so that it provides a concentration of 24% to 44%. If you're moving to the simple face mask, 5 liter per minute to 10 liter per minute is the concentration we need to give. And the percentage is 40% to 60%. Partial rebreather mask should be provided between 8 to 10 liters per minute, and it will give a concentration of 50% to 75%. Non-rebreather mask, the minimal rate of flow is 10 liter per minute. That means it gives a concentration of 90%. If you see the Venturi mask, 2 to 15 liter per minute is the amount of oxygen which is delivered, and it gives an oxygen concentration of 24 to 60%. In the previous question, one option was 24%, the other was 50. So that 50% also comes in this range. So that two options were correct. I hope you understood how we gave the answer for the previous question. The nurse is caring for a patient who is receiving oxygen therapy via the Venturi mask. Which complications are associated with oxygen therapy? Select all that apply. So you need to know about the complications associated with oxygen therapy to answer this question. Oxygen toxicity, cachexia, bradycardia, absorption atelectasis, and increased dead space. Here you need to know what are the complications. So the answer is, one is oxygen toxicity and the other one is absorption atelectasis. You need to know what is cachexia. Cachexia means that is muscle wasting. It won't happen with oxygen therapy. Bradycardia is also not possible with oxygen therapy, so that is not a complication, and also it won't increase the dead space. Let's see the complications of oxygen therapy. The main complications of oxygen therapy are four. First is oxygen toxicity. Oxygen concentration equal to or greater than 50% over 24 to 48 hours if we are giving, that can result in oxygen toxicity. If you are giving oxygen concentration which is equal to or greater than 50% over 24 to 48 hours, the high level of oxygen damages the alveolar capillary membrane, and also it inactivates the surfactant production in the lungs. You know that when there is loss of surfactant, the walls of the alveoli, it will stick together and it will collapse. The collapse of the alveoli, it makes the alveoli not to reinflate. It will be filled with fluid or blood later on. That results in pulmonary edema, which is known as atelectasis. And also later on it will contribute to hemorrhage and can progress to acute respiratory distress syndrome. So oxygen toxicity happens when oxygen concentration equal to or greater than 50% is given more than 24 to 48 hours. So you should be very careful as a nurse so that it should not result in alveolar collapse later on. Second one is absorption atelectasis. The high level of oxygen dilute the nitrogen that normally present in the alveoli. from collapsing. So this nitrogen is the one which prevents the alveoli from collapsing, and when this high amount of oxygen is going, it will replace this nitrogen. And when oxygen is filled more in the alveoli, what happens is that it will be diffusing from the alveoli into the bloodstream also faster. So it causes again the alveoli to collapse. So absorption atelectasis is also a complication. Third one, mucous membrane dryness. When oxygen therapy is prescribed at levels greater than 4 liter per minute via nasal cannula, humidification, it is very much needed. The fourth one is infection. There are potential chances of infection during oxygen therapy. It can be because of the equipments which we are using. So we need to be very careful about all this complication. Hope you understood this video. Please do subscribe to know more about NCLEX RN questions. Thank you.